All right. Hello, 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 and welcome to Nursing News You Can Use live at 5. Today is Wednesday, October the 1st, 2025. Are you ready to kick off this last quarter of the year? What are your goals? What are your plans? How are you going to just wrap up this year? Let's start thinking about our success goals for the last quarter. All right, let's get into it. Here's our affirmation for today. And it says, this is a feeling you're going for when you make a huge leap in your life. Equal parts excitement and terror. I'm going to say that again. This is the feeling you're going for when you make a huge leap in your life. Equal parts excitement and terror. In other words, let's get out of our comfort zone. Let's do something a little bit different. Let's expand our horizons and take that leap of faith. All right, let's get into our news today because we do have a lot to cover. And I do have another place to be, so I have to get in and get out today. But I do want to cover the news because it's so important. Then we've got a few announcements happening. All right, so let's get to it. This first article is coming from Politico. And as some of you may be aware, but some of you may not so far, but we do know that we're in the midst of a government shutdown. It says government grinds to halt over health care. So the government has shut down for the first time since 2019 after lawmakers failed to reach an agreement to extend federal funding by midnight on Thursday. The impasse came after Democratic leaders demanded an extension of the Enhanced Affordable Care Act subsidies that were set to expire at the end of the year to be included in a funding extension, while Republican leaders refused to back down from their push for a clean 7-week stopgap spending bill. Although some Republicans are open to negotiations on extending Obamacare tax credits, GOP lawmakers didn't want those discussions to be part of the government funding fight. After a bipartisan meeting Monday between congressional leaders and President Donald Trump, which failed to produce a deal on a funding extension, White House officials opened the door for the first time to possible bipartisan negotiations over an extension of the health insurance subsidies. But Vice President J.D. Vance also suggested that a shutdown would impede those talks. Meanwhile, Democrats said nebulous promises of future negotiations wouldn't suffice. So while Republicans seem united on the public stage in the showdown fight, the Obamacare subsidy issue is already splitting the party. Politico's Meredith Lee Hill reports Trump hasn't publicly ruled out an extension, raising alarms among conservative Republicans who despise Obamacare and would be more than happy to see the tax credits sunset December 31st. Deep internal GOP divisions have led House Speaker Mike Johnson and Senate Majority Leader John Thune to privately argue to Trump's team that any talks around a possible extension will take months on Capitol Hill. So this is why it's important to healthcare and why I'm reporting on this today, because this is what we need to know. We're going to have a follow-up story as well on this. But it says that more than 32,000 staffers from across the nation's health agencies will be furloughed, or roughly 41% of the Health and Human Services workforce. Services across the various HHS agencies will be hit differently. So you're talking about the Centers for Medicare and Medicaid, federal health insurance programs, including Medicare and Medicaid, are considered mandatory, and they will continue. The CDC, about 2/3 of the CDC staff will be furloughed. The agency will continue its responses to urgent outbreaks, but it will cease coordination with state and local health departments on opioid overdose prevention, HIV prevention, and diabetes prevention. The FDA, most of the FDA staff will continue to work, and the agency will still support food and drug reviews, but they will limit the number of inspections it conducts unless they are deemed necessary to address imminent threats to human safety. HHS sent an email blast to its employees on Tuesday afternoon, blaming the impending shutdown on Democrats in Congress. President Trump opposes a government shutdown, according to the email seen by Politico, which added that the president supports a clean, continuing resolution to fund the government through November 21st. If congressional Democrats maintain their current posture and refuse to pass a clean, continuing resolution, which I don't even know what that means. Anybody know what that means? Let me know. To keep the government funding before midnight on September 30th, 2025, federal appropriated funding will lapse. Spokesperson for HHS, Andrew Nixon, told Politico that the Trump administration wants to keep the government open so HHS can continue to provide critical services to safeguard the public's health and well-being. Also added that the Democrats are threatening a shutdown that would impact the care to millions of Americans. So here's where some of this comes into play. Um, and there's more to this story. So you can head on over to Political. I'm not going to get into it because it's more of this back and forth stuff, and then stuff about who's getting what and what whose pocket with the mainstream, um, all these different drug companies. But I did want to share because I think for us as healthcare workers, this is why I'm sharing this. We know what this means for us, right? What does it mean giving hospital care? So I went over to this other source. This is Healthcare Finance News. And it says how the government shutdown affects hospital payment. Because obviously, we want to know what's happening with Medicare and Medicaid reimbursement because we need to be able to take care of patients and get paid for doing it. So the government shut down at 12:01 this morning. With much of the partisan stalemate focused on healthcare, Republicans had a measure to keep the government running for the next 7 weeks, as already approved by the GOP-led House. But Democrats were adamant that cuts to Medicaid be restored and that the Affordable Care Act premium subsidies be continued past the expiration date at the end of the year. Which, here's my problem. Okay, we all knew that these things were coming. These expenditures and things like that. Why is it we always wait to the last minute? Why can't we, like, okay, we know this is going to happen, so we need to make sure we have a plan in place. And we should have been talking about this. I mean, I know they've done some stuff, don't get me wrong, but it just always seems like they wait for crisis to happen. And then we try to do something. Okay. So anyway, so what does this mean for hospitals? It says Medicare and Medicaid reimbursement will continue, but Medicaid payments are dependent upon federal appropriation. The two programs differ in their funding mechanisms. Medicare payments to hospitals are mandatory and are not subject to the annual appropriations. Therefore, they are unaffected by a government shutdown. However, Medicaid is dependent on federal appropriations and it does not have a trust fund. The Centers for Medicare and Medicaid Services has confirmed that there is sufficient funding for Medicaid through the first quarter of 2026. So in other words, we've got enough to kind of last us for a little while. But unless they appropriate more money after that first quarter, we're going to be in trouble. So after that, there would be a funding lapse without a federal appropriation. Continuation of payments is not a certainty if the funding lapse were to continue for more than a calendar quarter. Other programs critical to hospitals are telehealth and virtual care, which is why I peaked up, especially as the latter pertains to acute hospital care at home programs built by health systems during the COVID-19 pandemic. And so we have a lot of investment in telehealth and virtual programs. And now all of a sudden it seems like we're not going to be able to continue those programs. You know, we may have to stop some of those. And that's concerning because we've got people that live in rural areas and it's very hard for them to get in to be seen. And so a virtual appointment is often their best option. So let's go on. It says, the AHA urges Congress to work together on a bipartisan solution to fund the government. Several critical healthcare programs expire on October the 1st, including telehealth and hospital at-home waivers, both of which enable patients to receive high-quality care in patient-centered settings. A September 15 AHA letter to congressional leaders outlined the programs that needed to be addressed by October 1st. Among other requests was an extension of the enhanced premium tax credits that help consumers who don't have health insurance through an employer or the government to afford coverage through the ACA marketplace. And can I just say something? I really think it was a bad idea to tie healthcare to employment simply because what if the person is self-employed? What if the person has, can't work? I don't know if they've got Medicaid and all that stuff available to them. But it to me, it just makes more sense to make it easier for people to keep their benefits and all this kind of stuff, no matter where you work. So that's the more rational side of it to me. But I know why they did it, because it was a benefit for the employers and all this stuff. But I think we need to rethink all that. But that's neither here nor there for this discussion, because right now we're in a world of hurt. Okay, so this is why I don't understand why they're saying this, because this is for people that don't qualify for insurance through their employer, because maybe their employer is not big enough to offer benefits, and they're working, so they're not as poor as they need to be to qualify for Medicaid, because I have several clients that are in that position right now. And so why would we think that we're going to use this money to provide health care to illegal aliens? This is actually about the working poor. This is about people that are working, the middle that's out there working. That's why I can't figure out why this is the argument against this. So, because that's not what it's about. So, among other requests was an extension of the enhanced premium tax credits to help consumers that don't have health insurance. It also says without the premium tax credits, millions of people would be at risk of losing their coverage if they could not afford a 75% increase in their out of pocket premiums. Rural states are projected to experience a 30% decrease in marketplace coverage and nearly a 40% increase in their uninsured populations. So we're talking about basically the bedrock of society, middle class, lower middle class persons, the people whose shoulders we often stand on. Okay. So it says this loss of coverage would put considerable stress on hospitals and health systems, which will experience more uncompensated care and bad debt. There will also be an impact on the entire community, even those with coverage, because an influx of uninsured patients into emergency departments, causing longer waits, stress on the whole healthcare system, and the inability to get the care they need. So this is from President and CEO Richard Pollock from AHA. And so this is another thing that I was really concerned about. It says, as of Wednesday, provider payments for telehealth and virtual care ended. The federal government expanded the use of telehealth and virtual care during the COVID-19 pandemic, and when the public health emergency ended, Congress continued their use through extensions. The ATA has long advocated for permanency for the programs. Telehealth physician appointments have become the norm. Virtual care has allowed health systems to build hospital care at home programs that free up bed capacity and give patients the option to receive acute level care at home. So, Dr. Chris Gallagher, founder and chief strategy officer of Access Telecare, a provider of acute specialty telemedicine, said beyond greatly improving access to care, telemedicine significantly increases health equity. To provide an idea of the scope of telehealth's impact, more than 84% of the patients that we provide care for through our hospital and clinic partnerships are medically underserved and vulnerable. Many of these patients receive acute specialty telemedicine live in rural areas and designated health professional shortage areas. So now we have, again, mass layoffs. We've got more than 150,000 federal employees will leave the U.S. government payroll this week after a buyout. Workers who opted into a deferred exit program will be kept on the payroll through September. The buyouts were not part of the Department of Government Efficiency's efforts, DOGE, efforts to trim the workforce, but employees were given financial incentives with threats of dismissal if they declined the offer. Agencies ordered to drastically slash their workforces over the last 8 months are now reportedly hiring back hundreds of workers, according to NPR, because it's like, oh, we got rid of too many people, and now we can't function. And so there's a lot going into this. So this is important. So we need to pay attention, because it does affect us and how we're going to be able to care for our patients. So if you have any insight in any of this and you want to share that, please go ahead. I'd be happy to take your comments right now. All right, so let's go on to our next story. Okay, so all right, this is one. This came from nurse.org. Um, This is another one that just really, butters my biscuits. Okay, just really burns me up. Okay, so this is coming out of California, and we're going to see that we're going to continue to have this pushback, and it happens to be one of my dear friends was involved in this, but in the case. But I just want to say, this really upsets me. It says nurses with doctorates cannot tell patients that their doctor's court rules. California nurses with doctors do not have the right to call themselves doctors. A federal court ruled upholding a state law that regulates what titles health professions can use in advertisements. In a September 19th decision, the U.S. District Court for the Central District of California rejected claims by nurses with Doctor of Nursing Practice or DNP degrees that the state violated their free speech rights by banning them from the use of doctor, the title doctor, in the healthcare setting. The use of doctor by non-physicians in clinical settings is, quote, inherently misleading commercial speech and is not protected by the First Amendment, District Judge Jesus G. Bernal wrote in his ruling. Pacific Legal Fund attorney Donna Matias, who represented the nurses, said the plaintiffs were disappointed that the court failed to grapple the relevant Supreme Court precedent that protects First Amendment rights. Instead of reining in the state's power to censor professionals who accurately describe their credentials, the decision emboldens it. Oh, excuse me, this story was in Medscape. Sorry, it was also on nurse.org, but this was from Medscape. The First Amendment does not allow the government to silence truthful speech simply because some listeners may be confused, especially when disclosure can address any concerns short of a total ban. The defendants in the case, California Attorney General Rob Bonta and California Medical Board President Christina Lawson, did not return messages seeking comment. The California Medical Association welcomed the decision, saying it opposed the state's well-established prohibition against non-physicians using the title doctor in healthcare settings. So my question is, are psychologists then allowed to call themselves doctors in the healthcare setting? What about physical therapists that have doctorates in a healthcare setting? What about dentists? They're in a healthcare setting. What about doctors of optometry? They're in a healthcare setting. See, these are questions that I bring up because I think people are smart enough to figure this out. And if you want to use your credentials, you can say, and this isn't hard to do, for example, I'm Dr. John Smith, nurse practitioner, PhD, DNP, whatever, right? You can say that. You can say, and I routinely introduce myself, give my name, and the nurse practitioner. I don't say I'm a physician because I am not. If you want to be identified as a physician, say I'm Dr. John Smith, a physician. How hard is that to do? Anyway, let's go on. So they have the same BS that says basically people are stupid and we need to protect them from their own stupidity, which is basically their argument. And it says under California's Business Professionals Code, anyone who refers to themselves as a doctor in words or in advertisements without having a valid certificate as a physician is guilty of a misdemeanor and subject to sanctions. So 3 California DNPs sued the state over the law in June of 2023. 2 of the plaintiff nurses said they've used their title, doctor, in the past on embroidered clinician jackets, clinical documents, nameplates, and on social media. Before learning about the law, plaintiff Jacqueline Palmer testified that she introduced herself to her patients as doctor, but always added she was a nurse practitioner. A third plaintiff intended to use the title when he opened his aesthetic clinics, but put the opening and on its website on hold after he learned about the law. In their complaint, the nurses contend the state law unconstitutionally criminalizes the use of doctor and that the measure does not serve a compelling state interest. They argue their use of doctor is not misleading and that state law regulates more extensively than necessary. Attorneys for the state asked the court to throw out the suit, arguing that the law is a legitimate regulation of commercial speech because the plaintiff's use of doctor is inherently misleading and that the law advances a substantial governmental interest. Okay. In his ruling, Bernal wrote the harms cited by the state over DMPs calling themselves doctors are, quote, real, and the evidence shows such titles by DMPs can confuse patients. Bernal cited an AMA survey that found, first of all, the survey that you use, sir, I call this into question, was actually done by the AMA. So right there, you know who's conducting the survey. So maybe we should have a third party, independent, to run this survey. If you're going to use this, and then here's what the survey found out. 39% of the patients believe a DMP is a physician. Okay. So 60% of the people know that a DMP is not a physician. The majority of the people, by your own survey, know that a DMP is not an MD. Faulty logic here. I don't know anything about this judge, and I'm not going to cast any aspersions against this judge. However, I'm curious about the background of this judge. Anybody that's in California and know, let me know if you know anything about this particular judge, because I'm just curious. But I'm like, this actual survey proves that the majority of people know that a DMP is not a physician. Because you just said 39% of the patients believe a DMP is a physician. So that means 60%, over 60%, 61% to be exact, know that a DMP is not a physician. Did anybody clock that? This is the survey by the AMA. So your argument that people are stupid, because that's basically what you're saying, not to put words, but that's basically what you're saying, it's false. Listen, I have nothing. I am not going around saying I'm a doctor, physician, or anything like that. And I don't have a doctorate, so I'm going to tell you that right now. I don't have a doctorate. So I think people are a lot smarter than we tend to give them credit for. And I think we need to look at our language and be clear about our language. Anyone can have a doctorate in whatever setting. The question is, what is your doctorate in and what do you practice? So you can be a PhD and have a doctorate and you do research. You can be a MD, a medical doctor. That is what distinguishes you. You are a medical doctor. You are a physician. It is not saying that just because you have a doctorate, that means you are a physician. That's a false equivalency. And I think medicine has had a chokehold on healthcare for far too long. That everything that medicine is the be all end all and everything in healthcare. And this is what they're fighting for, is control of their piece of the empire. And how they do that is make everybody else and everything else that anybody else does is ancillary to what medicine does. And that's not necessarily true. And so we need to take a step back in this. And I know, don't come for me in the comments, because I know there'll be people on there who are like, well, if you want to go to medical school and spend all this time in residency, I get that. Believe me, I get that. But my point is this: health, wellness is not just that little piece in medicine. There's a lot more to it. And I think we need to expand our thoughts and our knowledge base around what constitutes healthcare. So go ahead and read this story. Lori Brown said that who represents nurses and providers. So she was surprised by the ruling. If a nurse obtains a DNP, it's reasonable that they should be able to refer to themselves as doctor, adding that other professions with doctors do not face the same scrutiny. And that is my point. That is my point. It is only when it's the nurse. There is a big affront to physicians, and I'm not saying all physicians, but as a specialty as a whole, that when someone who is a nurse calls themselves anything or does anything that they don't have control over, they lose their stuff. And this is a problem. This is something that as nurses we've been calling out even more and talking about our own profession with our own theoretical scientific body of knowledge, and talking about our nursology. And by the way, if you're wanting to know, I do have t-shirts that says I am a nursologist if you're interested. But anyway, that's an aside. But we're talking about the science of nursing, the study of the field of nursing with our own knowledge base. And so what I am saying is that too long we've been kicked to the side as if we aren't real players. And I can guarantee you, as any patient in the hospital right now, yes, the doctor plays an important role, but the doctor goes home, and who's left to take care of them and manage everything with their care? It's the nurse. And I think it's time that we put some respect on that. That's all I have to say. I'm going to leave that alone. I think it's time to take a break. Let's do that. Nurses, are you burnt out, frustrated, looking for something new? Are you looking for more? Nurses, are you ready to feel the sun? You will dream big and expand your consciousness as an entrepreneur. Your nursing license is your key to freedom. Join the Nurse Shark Academy at the nursesharkacademy.biz today. All right, let's get back into our news story. You know I'm on one today, right? All right, I just get passionate about this because I think it's important. But let's go on to Cleveland. So CSU eliminates 22 programs, including nursing doctorate MBA options. Excuse me, Columbus. Cleveland State, Columbus, Ohio. Cleveland State University is permanently discontinuing 22 academic programs, suspending 14 programs for now, and is reopening admissions to another 4. Unlike program eliminations recently announced by Ohio University and the University of Toledo, these program changes are not the result of a sweeping Senate Bill 1, a controversial new higher education law that is in part requires public colleges to eliminate low enrollment programs. In fall of 2023, CSU began a comprehensive review of its academic programs, said an email from the university's marketing and communications department. Based on this careful and sustained analysis, we made the strategic decision to revise certain program offerings in May of 2024. CSU has been cutting programs and personnel to make up for millions in revenue gap. Fewer students are attending CSU, as well as other colleges throughout Ohio and the U.S., due to families having fewer children and young people opting against college because it's expensive. It's a trap. They trap you in these student loans and you can never get away from them. Yeah, okay, let's go on. Students who enrolled in suspended or discontinued programs are able to complete their degrees. Please note that at this time, it is not necessary for CSU to eliminate academic programs as a result of Senate Bill 1. Thanks to our proactive work over the past 2 years, we adjusted our offerings thoughtfully and strategically, with students and academic quality at the center of each decision. So the following programs have been permanently discontinued: Historic Preservation Certificate, Historic Preservation Graduate Certificate, Physics, Medical Physics Graduate Certificate, the History of the African Diaspora Certificate, Doctor of Nursing Practice, Early Childhood Generalist Endorsements, grades 4 to 5, Environmental Studies, Environmental Studies Accelerated, Environmental Studies MA, Literacy Development and Instruction, Middle Childhood Education, Masters in Education, Middle Childhood Mathematics Education Graduate Certificate, and Middle Childhood Science Education Graduate Certificate, Special Education with Licensure, Masters, Teacher Leader Licensure, I don't like Urban Economic Development and Finance Graduate Certificate, Urban Economic Development Graduate Certificate, and Finance Certificate, Urban Studies, Master's Program, Dual Exchange, Business Accelerated MBA Program online, Entrepreneurship Graduate Certificate, Sports Management, BS in Education, although the Sports and Entertainment Management BA is active. And the following programs have been suspended for now: Anthropology, Arabic, Comparative Religion, French, Linguistics and Music Therapy, Spanish, Urban Studies and Political Affairs, Public Affairs, Business, Doctor of Business Administration, Business Executive MBA Program, Economics, Engineering Mechanics, and Environmental Engineering. Admissions to these following programs were reopened: Art, BA, Art History Concentration, Chemistry, MS. Okay, that makes sense. Elementary education, teacher education, and secondary education, master's in education. So I just find this interesting that they got rid of their D&P program, which is why I brought this up, because I was looking to see where they were doing it, and there's a lot of interest, I'm seeing with this, because there's a is it worth it to sometimes go to school? That's another question for people, and you have to make that decision for yourself. But we're seeing a lot of effect that's happening to our academic institutions. Funding is a whole big other issue. Okay. All right. So let's talk about this one. This is from Healthcare IT News, and it's kind of going back to the government shutdown. I just want to share some of this. It says patients and providers face telehealth cliff as government shutdown begins. The U.S. Senate failed to pass a resolution to fund the federal government before the September 30th deadline. So among other far-reaching consequences of this most recent government shutdown, it means the sun has set on the latest extension of the CMS telehealth and acute hospital care at home program flexibilities, which have been extended numerous times since they first were authorized as part of the COVID-19 emergency. And this is why I'm saying, you knew this was coming. Why didn't y'all just make this permanent? Why do you keep just kicking the can down the road? Make a decision. Y'all grown ups. Y'all supposed to be able to do this. That's what we put you in office for. Make a decision. Fix this. Fix this. This should have not been anything that was on the table. You should have been embracing this. This could help cut down on your healthcare costs. Make it make sense, people. Make it make sense. So now we don't know about reimbursements, and so that's more information. And so it says some providers could continue to offer telehealth services, taking a gamble that they would get paid retroactively after the shutdown is resolved and their claims are assessed by CMS. So we don't have any information on CMS website at this time. Responding to requests for comment, a spokesperson for the ATA noted that its members are navigating the challenges of the government shutdown in real time and are approaching their go-forward strategy in different ways. The shutdown is forcing healthcare providers and systems to make difficult decisions regarding telehealth services, with some providers continuing care or planning to absorb costs in hopes that a retroactive reimbursement provision will be enacted, recognizing the critical care outweighs the risk. So we'll see what happens, but I just wanted to share that more with you about that, because we don't know what's going to happen. This is coming out of Seattle. Seattle nurses are picketing. So safe working conditions, adequate staffing, and better pay are some of the issues with the Seattle Children's Hospital. Pushback on these demands by the hospital's negotiating team prompted an informal walkout. So, over the course of two rallies in the morning and afternoon, about 1,000 nurses were picketing. So, we'll keep an eye on that. They've got further negotiations going on. They're talking about anti-union busting, things like that are happening. So let me know what's going on in your neck of the woods. But that's Seattle that's striking. And then we have this from Henry Ford's Hospital from the Detroit News. Striking nurses at Henry Ford Genesis turned away after shooting, union rep says. This is from the Detroit News. This is something you've probably heard of, but if you haven't, unfortunately, there was an incident in Michigan, and let's just get into it. So, some nurses from Genesee County Hospital that is caring for multiple victims of a mass shooting in Grand Blanc Township on Sunday said they were turned away from helping because of a labor dispute. Dan Glass, president of Teamsters Local 332, which represents roughly 750 nurses and caseworkers at the hospital on strike, said at least 6 striking nurses were turned away by hospital administrators at Henry Ford Genesis after they asked if they were needed to help with shooting victims. We're in a labor dispute, but the human lives mean more than anything at this point, right? Glass said Sunday. A spokesperson for Henry Ford said that the hospital is fully staffed, but appreciated the union members' willingness to help. We understand and appreciate the Teamsters' instinct to care for their neighbors during this time of heartbreak, and we will not hesitate to reach out if we need additional assistance. We look forward to coming together again to care for our community. Roughly 750 nurses and caseworkers at the hospitals began picketing September 1st after rejecting what their union described as an egregious final contract offer. Glass said some of its members went to a reunification point across the street from the Church of the Latter-day Saints in Grand Blanc Township, where family members were gathered to help people on and off buses and help people in gurneys with EMS. Many were ER and ICU nurses who could have helped out in that situation if needed. They should not be turned away from anything when you have something that's major. You need everybody, especially nurses that have been in that hospital for 20 and 30 years. Why would you turn away skilled professionals that know the hospital? Henry Ford responded, saying that its team members continue to provide compassionate, expert care on this heartbreaking day and why we are unable to welcome them back. Strikers don't have access to hospital systems, including electronic medical records, nor are they able to access medications for privacy and security reasons. Henry Ford Health spokesperson Lauren Zakalik said in a statement that would make it impossible to provide patient care. So, yep, that's what they said. That's what's going on. Okay. Here's another one from a nursing home care. This is from New York, and it says state leaders back bill that would transform nonprofit nursing home care. State Senators Samara Brooke and Jeremy Cooney joined several assembly members Monday at the Jewish home in Brighton to highlight the benefits of the Synergy Collaborative to improve nursing home efficiency, reduce avoidable hospitalizations, guarantee access, and yield area-wide performance improvement bill. I'm so glad they gave it a acronym, Synergy. The legislation would establish a program to allow all nonprofit nursing homes to collaborate and give them access to certain reimbursement rates. It aims to improve quality of care at facilities across the state while helping them discharge patients more efficiently and reduce unnecessary hospitalizations. It will improve the continuum of care for nonprofit nursing homes and long-term care residents, Brooks explained. It will allow nursing homes the ability to collaborate and encourage them to hit quality mentions with an opportunity in the future for increased reimbursement rates. The bill has passed the state assembly and Senate and is awaiting approval from Governor Kathy Hochul to be signed into law. So, all right, there's a little bit of maybe some good news on the horizon there. Okay, so this is another story. So this happens to be a malpractice litigation case, and I just brought this up because I think it's important that we understand what's happening in some of these cases. So it says Tampa General Nurse Negligent and stroke case jury finds and awards the patient $70.8 million. Okay. So Shakika Stewart's headache was so painful that emergency responders rushed her to a Brandon freestanding emergency room run by Tampa General Hospital. She told the nurse in July of 2021 that her pain was worse than she'd ever known and that she had gone back on birth control, a risk factor for blood clots. Stewart, 41, was also at a higher risk because she was overweight and had diabetes. But no one at the freestanding emergency room ordered a CT scan, which would have shown the presence of a blood clot, said her attorney, Adam Hetch. Instead, she had blood work and a COVID-19 test and was discharged 4 hours later with headache medication. 2 days later, the Brandon resident suffered a stroke and was rushed to Tampa General's main hospital, where imaging revealed extensive blood clots in her brain. It was too late to prevent permanent damage. Stewart will live the rest of her life mostly blind with some paralysis on her left side. A single mom with 2 kids, she also has problems now memorizing and concentrating and suffers from a severe stammer. She is unlikely to be able to work again. After a 2-week civil trial in Tampa, a jury on Thursday awarded Stewart $70.8 million in damages for the emergency department's failure to spot and treat her life-threatening injury. But Stewart may only receive a fraction of that money since she is on Medicaid. A Florida law limits non-economic damages in medical malpractice cases when the injured party is a Medicaid recipient to $200,000, which I think is very egregious. Okay, so who's going to be paying for the rest of her life and taking care of her because she's on Medicaid? So, yeah, that's sad. That is sad. I'm sorry. That was enough to, like, oh my gosh, this woman who has children has to provide for her children for the rest of her life, gets the settlement, and the state takes it. In the lawsuit filed in August of 2023, named Tampa General Infinite Contracting Services and their agency nurse Heather Anderson and advanced practice registered nurse as defendants. The jury found Anderson was negligent in her treatment of Stewart and that she was acting as an agent of Tampa General. Stewart had all these risk factors. The nurse, for some reason, just treated her like this was someone who came in and said, I always have a bunch of headaches. Tampa General staff declined to answer questions about whether it would be appealing the jury's decision in appellate court and what percentage of the damages the hospitals would be required to pay. Okay, so again, they can't talk about it because of HIPAA and all this stuff, and my heart goes out to the family. But I also think that this is kind of terrible. It says Dr. Dayanis Drukatinis, the emergency department physician, who was on duty when Stewart first started treatment, was also named in the lawsuit. Like the emergency department nurse, he worked at the hospital through a contract with Infinite. He agreed to settle out of court before the case went to trial. It's unclear if Drukanis had ever examined Stewart. Medical records indicate that he did not, although Anderson testified that she consulted with the doctor about the patient. This is, again, y'all need to make sure you're documenting. In 2020, Florida lawmakers approved a bill that allowed advanced practice nurses to meet certain criteria to practice autonomously or without a physician's supervision in some settings. That includes diagnosing, ordering, interpreting tests, and managing plans, prescribing medications. Okay? So it doesn't require him to review. So the doctor says it doesn't require him to review or sign off on a patient's record compiled by a nurse practitioner before the patient was discharged. However, the nurse said she consulted with him and she should have documented, spoke with Dr. So-and-so clear for discharge or something like that, right? All right. So the CT scan of her brain was central to the trial. A neuroradiologist served as an expert witness for Stewart. Said the clot in her brain was so extensive that some clots would have been present 2 days earlier when she was first rushed to the hospital. Radiologists who put on for the defense said they agreed the clotting was extensive, but it's inconclusive whether they would have been present 2 days earlier. So the ED did have a CT scan machine. So they said, well, maybe if COVID wasn't around, I feel like my outcome may have been different. I feel like my care was rushed because the hospital was so busy. And again, that becomes the problem. You know, when we're understaffed, things are going on. This is why I bring this up. So unfortunately, this happened to this woman. My heart goes out to her. She's not able to work. She worked as a mortgage credit company before a stroke. She has two children, 16 and 10 at the time. And they're now her main caregivers. So her kids are now taking care of her. And so unfortunately, this is just a horrible situation. But I brought that up because it's so critical and important. Make sure you're doing, you're documenting, document. Okay, so this one I'm gonna have to get out of here because I'm late for a meeting. But I want to get this last story in for today, and this is, let's just do a nurse making a difference. Let's end on a happier note. Nurse making a difference. World War I nurse Mary Nerney. This was from nurse.org. Finally honored in Stanford and makes history. Mary Nerney, a Red Cross nurse in World War I, recently became the first woman honored on Stanford's Memorial Wall, a recognition more than a century in the making. This milestone not only corrects a long-standing omission from Stanford's history, but it also gives nurses everywhere a reason to reflect on the legacy of service and sacrifice that Nerney represents. Mary Camilla Nerney trained at Stanford Hospital, not Stanford, but STAM, STAM, Ford Hospital, and volunteered for the Red Cross during World War I. In the fall of 1918, Stanford was enveloped in the influenza pandemic, turning hospital wards into battlegrounds. Nerney, just weeks away from deployment to Europe, chose to care for sick soldiers at home. Unfortunately, she contracted influenza and died after 11 days fighting the disease. The courage she showed wasn't lost on her colleagues or patients. In a poignant act, the soldier said she had cared for insisted she receive a military funeral, even though nurses were not formally recognized as veterans at the time. As Reverend Henry Callahan said at her crowded funeral, while Mary had not made it to battle to face the flashing saber, she was a soldier nonetheless. For decades, Nooney's selfless act went unrecognized on Stanford's official war memorials, despite local officials noting she was the only woman to die in service during that period. Her memory lingered in street names and fleeting tributes, but she was not listed among Stanford's war dead, largely because she never officially served overseas. This year, that changed. After 107 years, Mary Nerney was finally added to the memorial wall in Stanford Veterans Memorial Park, becoming its first female honoree. As the Stanford Veterans Park Partnership announced, we are proud that the legacy of Mary Camilla Nerney, an American Red Cross nurse trained at Stanford Hospital during World War I, will be honored with the SVPP Patriot Award at our annual benefit on October 16, 2025. Steve Fisher, commander of the Stanford Veterans Council and the Stanford Jewish War Veterans, said at the dedication, her battlefield was the hospital ward and her weapon was care. Mayor Carolyn Simmons added, what an extraordinary woman to put her life on the line to care for soldiers. She's a remarkable inspiration. I always think of our nurses as angels. Mary Nerney's story is a reminder that nurses have always been on the front lines, whether the battle is across an ocean or right in the heart of their own communities. Her willingness to put herself in harm's way, her skill, and her commitment to her patients echo the values that continue to define nursing today. For Stanford, her recognition sets a new precedent. For nurses everywhere, her legacy demonstrates how every act of care can ripple through history, even if it takes generations for the world to fully honor that sacrifice. So, Mary, thank you for your service. That ends all that we're going to talk about today. I think that was a good way to end. Let's talk about some things we have coming up. For those of you who would like to be guesting on podcasts, nurses and others in the healthcare field who want to learn about podcast guesting and being a guest on podcasts and sharing that, please sign up for our event, Podcast Power. That will be on October the 15th at 3 o'clock. You can register for that at the nurseSharkAcademy.biz. We also have coming up on the 15th At 6 p.m., we have our Alliance event. Our local Anderson Alliance event will be there that day. During that week, we also have a lot of events coming up with the Madison County Black Chamber of Commerce. So we have the prayer breakfast on the 16th. And then we have on the 17th, we have the president's reception at 6 p.m. On the 18th is the women's conference. And then on the 19th, we have the annual awards banquet. So if you would like to attend any and all of those events, please head on over to the Anderson Madison County Black Chamber of Commerce website and register for that event today. Um, for the banquet, the tickets are available. They are $40, so feel free to do that as well. All right, so that's going to end our show for today. And I will see you next week. As my friend says, if the Lord wills and the creek don't rise. All right, bye bye for now.